Hey everybody! So I just found some huge information that I wanted to share. This is one of my textbooks from medical school, Review of Medical Microbiology and Immunology, 10th edition. This is a 2008 copyright. Okay, so I wanted to read to you what the information from 2008 was in regards to CV. And I just have discovered some extremely revolutionary information. Okay. CV are an important cause of the common cold, probably second only to rhinoviruses in frequency. In 2002, a new disease, an atypical pneumonia called SARS, severe acute respiratory syndrome, emerged. CV have a non-segmented, single-stranded, positive polarity RNA genome. They are enveloped viruses with a helical nucleocapsid. There is no viron polymerase. In the electron microscope, prominent club-shaped spikes in the form of a halo can be seen. There are two serotypes called 229E and OC43. The genome sequence of the CV that caused the CoV-SARS outbreak is different from the existing human strains. The genome sequence of different isolates of CoV-SARS is very similar, so the antigenicity of the virus is likely to be quite stable. That means that if you're infected with SARS, you likely have immunity to other forms of CV. So if you're immune to one, you're immune to all. That's what it means. The receptor for the SARS-CoV on the surface of cells is angiotensin converting enzyme. Now this is huge. This is huge. So the way that CV gets into cells is via the angiotensin converting enzyme 2. Now, this is what people take called ARB drugs. They're angiotensin reversing blockers. And it's a drug that blocks this enzyme for usually people with diabetes or high blood pressure. Now, these are drugs called losartan or valsartan. And recently, there was a huge recall of these drugs, of these ARBs. A similar drug is an ACE inhibitor like lisinopril, but these block ARBs like losartan or valsartan, which were recalled over the past 2 years because apparently there was a contaminant in the medications that were made in India. So they recalled these medicines, and people were switched from these medicines to other medicines like ACE inhibitors, like lisinopril. So it's assumed that you can deduce that people taking ARBs, a medication that blocks this enzyme, has a reduced chance of getting this virus. So people taking ARB drugs probably have a less likely chance of getting the virus transmitted into their bodies. That's huge. So the fact that they recalled all of these drugs prior to this infection is a huge move to reduce people's protection. Okay, moving on. The virus absorbs to cells via its surface spikes, hemagglutinin, after which it enters the cytoplasm where it is uncoated. The positive strand genome is translated into two large polypeptides which are self-cleaved by the virus-encoded protease. Two of these peptides aggregate to form the RNA polymerase, the transcriptase, that replicates the genome. In addition, messenger RNAs are synthesized, then translated into the structural proteins. The virus is assembled and obtains its envelope from the endoplasmic reticulum, not from the plasma membrane. Replication occurs in the cytoplasm. Transmission and epidemiology. CVs are transmitted by the respiratory aerosol. Infection occurs worldwide and occurs early in life, as evidenced by finding antibody in more than half of children. Outbreaks occur primarily in the winter on a 2 to 3 year cycle. SARS originated in China in November 2002 and spread rapidly to other countries. As of this writing, there have been 8,300 cases and 785 deaths, a fatality rate of approximately 9%. Human-to-human transmission occurs, and some patients with SARS are thought to be super spreaders, but this remains to be confirmed. Early in the outbreak, many hospital personnel were affected, but respiratory infection control procedures have greatly reduced the spread within hospitals. There are many animal CVs, and they are suspected of being the source of CoV SARS. The horseshoe bat appears to be the natural reservoir for CoV SARS, with the civet cat serving as the intermediate host. CV infection is typically limited to the mucosal cells of the respiratory tract. Approximately 50% of infections are asymptomatic, and it is unclear what role they play in the spread of infection. Immunity following infection appears to be brief, and reinfection can occur. Pneumonia caused by SARS-CoV is characterized by diffuse edema resulting in hypoxia. That means you don't have enough oxygen in your blood. The binding of the virus to the angiotensin-converting enzyme 2 on the surface of respiratory tract epithelium may contribute to the dysregulation of fluid balance that causes edema in the alveolar space. Now, this is why this is used for diabetes, to help change fluid levels, but it usually works in the kidneys. So again, if you take ARB drugs, you likely have a resistance to getting this viral infection. Clinical findings. The common cold caused by CV is characterized by coryza, which means rhinorrhea, a runny nose, scratchy, sore throat, and a low-grade fever. This illness typically lasts several days and has no long-term sequelae. CV also causes bronchitis. That means like a cough. SARS is a typical atypical pneumonia characterized by a fever of at least 38 degrees Celsius, non-productive cough, dyspnea, and hypoxia. Dyspnea is trouble breathing. Hypoxia, again, is low oxygen in the blood. Chills, rigors, malaise, and headache commonly occur, but sore throat and rhinorrhea are uncommon. Chest x-rays reveals interstitial ground glass infiltrates that do not cavitate. Leukopenia and thrombocytopenia are seen, which means low white blood cells and low platelets. The incubation period for SARS ranges from 2 to 10 days with a mean of 5 days. The diagnosis of the common cold is primarily a clinical one. If SARS is suspected, antibody-based and PCR-based tests can be used. There is no antiviral therapy or vaccine available. A combination of ribavirin and steroids has been tried in the treatment of life-threatening cases of SARS, but their efficacy is uncertain. Here's a little breakdown here. Common cold and SARS characteristics: enveloped virus with helical nucleocapsid and one piece of a single strand positive polarity RNA, no viral polymerase. There are 2 serotypes. Transmission: respiratory droplets, animal, leading towards a human infection. Infection is typically limited to the mucosal cells of the respiratory tract. At least 50% of infections are asymptomatic. Immunity is brief and reinfection occurs. Yeah. And there's just one other spot that went over the Oh, that was the wrong one. Sorry, guys. Okay, here. These are the different shapes and sizes of medically important viruses. As you can see, our guy is right in the middle. All right, bye guys.